Well, good morning, everybody. And thank you very, very much for inviting all of us to come by here this morning to be a part of this program. I thank you, Karen, for acting as the host. The Center for American Progress, I want to thank them as well. SEIU for your wonderful leadership. Andy Stern, I see Andy over here as well, for giving us a chance to be here. Let me also mention, by the way, I know he's already appeared here, and I didn't get a chance to see him. But I think all of us across the country have incredible respect for Elizabeth Edwards and for John Edwards and what they're going through here today. So I didn't want to begin these remarks talking about health care and not fail to mention them as well. I'm deeply proud of the invitation to be with you today. Proud of my relationship with the SEIU and its work over the 8 decades of serving the interests of not only its membership, but people across this country who are not members of SEIU who've benefited from your leadership. I've been through 8 elections in the state of Connecticut, and I'm proud to say that those 8 elections I've had the support of SEIU, and I thank you for that support. And for those 32 years that I've been in the Congress of the United States, I'm proud to say have about a 95% voting record with organized labor in this country. I stand with unions, I stand with labor, and I thank you as well. I'm proud of that relationship. I mentioned that to you this morning because I think it's important as we talk about where we want to go from here, how we want to lead the country, that we also have a good understanding of where you've been. And so over those 32 years, the work I've been engaged in on behalf of working people is something I'm proud of, but it gives you some indication of what kind of leadership I'll offer as the Democratic nominee for the presidency of the United States and how I'd serve the country. Again, I'm preaching to the choir here in a sense and talking about health care. We all know that it's in a serious crisis. The numbers are startling. It is said that we have, I think, ranked something like 26th in the world in life expectancy, something like 28th in the world in infant mortality rates. There are even 3rd and 4th world countries that do far better than we do in protecting our youngest children here in this country. We rank something like 37th in the world in terms of the overall fairness of our health care system. And we account for more than 50% of all the money spent worldwide on health care in the United States. So anyone who tells you this health care system is working, those facts alone ought to be a source of collective shame in this country. The fact that we rank as poorly as we do, this is the United States of America, the most affluent country in the history of mankind. We need to be doing a far better job in serving the American people when it comes to health care. I stand firmly in my efforts to see that happen. Let me state to you here as well what needs to be done. First of all, it's important we talk about health care that we don't limit the conversation to what needs to be done within the health care system itself. It was pointed out that in the 20th century, we extended life expectancy in this country by 30 years. Only 5 of those 30 years can be accountable because of improved health care. About 25 of those years actually come from better nutrition, better housing, better jobs, better incomes for people in this country. That had more to do with increasing life expectancy than actually the health care system itself. The reason I mentioned that to you is because it's very important that as we examine this issue, we also look at issues like income inequality, like the ability to have decent retirement, decent wages, decent working conditions. Those elements we know empirically today improve the quality of people's health. If you're better off financially, if you're better educated, then the likelihood is you're going to be in better health. So we need to understand there's a direct relationship between people's ability to have good paying jobs with good retirement and good working conditions if you're truly interested in making a difference on health care in this country. It's very important those concepts and ideas be included in this discussion. As for the health care proposals themselves, let me quickly mention the 4 principles which I think are absolutely essential if we're going to deal with the health care system. One is what you've heard already, I'm sure, from the others as well, and that is universality here. That everyone participates, everyone benefits. That all the stakeholders, individuals, employers, the government are involved in coming up with a system here that will make it possible to reduce those numbers of 47 million of our fellow citizens who have no health care, to make sure they'll be included. Second is prevention alone. Merely what we try to do to see to it that we can reduce the cost by stopping people from getting ill in the first place. Around 70% of the health care costs in this country are associated with chronic illnesses in America. We need to be doing everything we can to see to it that people get screening, get the proper managed care, to reduce those kind of problems before they emerge. The health care system today deals with you when you get sick. We ought to be doing a far better job of making it possible for people not to become ill because of the incentives we provide and the alternatives we offer for people. In fact, the Veterans Administration, with all their other problems they have today, have been able to reduce hospitalizations by 60% in this country because of the work they've done on pre-screening and dealing with people before they become ill. So prevention has to be a major part of this. Thirdly is building upon the good things we've done already, 40 years of Medicaid and Medicare. I would extend Medicaid to poorer families, 100% of poverty, ones with children, 300% of poverty. Those programs have worked very, very well for people. Expanding them, extending them makes a lot of sense to me. And then lastly, we've heard from this as well, some $80 or $90 billion could be saved, not to mention the morbidity rates, by doing a far better job at utilizing the technology that exists today to see to it that people have an opportunity to improve their health conditions. Let me tell you what also is important in all of this. When looking at those of us who seek your support for this nomination, what have you been able to do? During the 26 years I've been in the Senate, I've taken democratic principles and made them national policies. I spent 7 years through 2 presidential vetoes to pass the Family and Medical Leave Act as my piece of legislation. 50 million Americans have enjoyed the benefits of that legislation, and I'm proud to have been the author of it. I started the Children's Caucus in the Senate. I authored the legislation dealing with improved Head Start, along with other programs dealing with infant screening, premature births, dealing with prescription drugs for children. In every instance, I've done it by reaching out to people on the other side of the political spectrum. Whatever we talk about here today needs to be a plan and a program that can build us and bring us together. We're not going to survive much longer in this country, my friends, divided 51-49. The ability to just do what we want to do is going to be dependent upon whether or not we can reach out to others and bring them to that table and sit down and work out these things together. We can't wait much longer. I've done it on every one of those pieces of legislation. That's what I do as a legislator. That's what I will do as a president of the United States, to bring the stakeholders together, work together with the common goals we all have in mind, and that is to see this country have improved health care, improved economics as well for the people in our nation. So I ask you today, as we talk about these issues, to look not only at what we offer you here, but also the proven ability to bring people together, where we've stood over the years and where we'll lead in the future. I'm the father of 2 very young children. I have a 2-year-old and a 5-year-old. In fact, my house right now is sort of like a petri dish. I've got a 5-year-old and a 2-year-old, and one has a strep throat, the other has an infection of some kind or other, and adenoids. And so dealing with children and their problems, going to school and coming back. In fact, I'm the only candidate that actually gets mail from AARP and diaper services. I want you to know I have a rather broad reach here as a candidate in talking about the needs of people across the country. But it's important to know what families go through when you have young children. I'm a United States Senator. I've got a wonderful health care program. I want every single American in this country to have as good a health care program as every member of the United States Congress. That ought to be something that all of us stand there and fight for.
Great.
So I thank you for listening. I ask for your support in the upcoming nomination process, and I promise as your president, we will deal with this health care issue. We'll pull the people together. We'll have a good, sound health care program for all Americans. Thank you very, very much.
Senator, do you want to...
Thank you, Karen.